All right, ladies and gentlemen, now I want to introduce to you Dr. Stephanie Ho. Come, Dr. Stephanie Ho. Okay, sit. Dr. Stephanie Ho, thanks for coming to Dr. Loli Talk Show.
Thank you for having me.
Are you excited?
Very excited.
It looks like you got lots of hair.
I haven't been to the barber for a while.
Oh, okay, you save a lot of money, right? It's quite expensive nowadays to cut hair, right? Actually, it's getting cheaper. The barber is charging for guys at least only a few dollars, right? But for ladies, I understand you spend a lot of money on hair cut, perming, and so on. On average, lady, I heard that they spend over $700 worth on all this hair, tonic, shampoo, and so on every year. Quite a lot of money spent, you know, add up all together. So, Dr. Stephanie Ho, why don't you introduce yourself to the audience? I know you're a dermatologist. Tell us.
Yep, I'm a dermatologist. So I specialize in skin, hair, and nails. I am in private practice in Scott's Medical Center. I actually train abroad in the UK. I train largely in London. And I also worked in Hong Kong for a bit before I came back to Singapore 3 years ago. So now I'm running my own practice, yeah. So I do see a lot of hair problems, you know, in my work as a dermatologist. People come in with too little hair usually. Some unfortunate souls might come in with too much hairs in areas they don't want. So we can maybe touch on, you know, a bit of these things this evening, yeah.
So what is the reason why you want to be a dermatologist? I mean, we go to medical school, there are so many areas or disciplines you can go, you know, specialize in. Some like to be orthopedic
Why do I want to be a dermatologist? I kind of knew I wanted to be a dermatologist the minute I went through. I think most of us who are doctors here would realize that we only have like 2 weeks of dermatology training in medical school, but during that time, I just knew that that was what I wanted to do because it was a very visual kind of specialist area. You can actually look at somebody's skin immediately and with some knowledge, you can come up with some sort of a diagnosis and treat them. And actually the skin has a huge impact on people because this is the first thing that you see, you know, when you meet people. And it can, I think it's quite fulfilling to be able to treat them, treat their skin diseases. And, you know, once they are happy with that, we can go on to improve their appearance even further for those who want, you know, a little bit more help. But it's one of those specialties where, you know, you can make an instant diagnosis very often. You don't need a lot of imaging and tests and, you know, wait for results to come back before you can come to a good diagnosis.
That's
so,
true.
Yeah.
As a skin specialist, you can make diagnosis quite easily, sometimes by just looking at the patient. So today we are going to focus a lot of attention on the hair. So there are two big words we want to teach you tonight. One is called Hirsutism. Try, practice, Hirsutism. Hirsutism. So after tonight's talk show, you can go out and show off. You know what Hirsutism or not? Don't know, right? Come and attend Dr. Loli Talk Show. The second word I want to teach you is Alopecia. Alopecia. This is like a, you know, Sunday school, kindergarten. All right, what is Hirsutism? Hirsutism is having too much hair on ladies, on places where you don't want to have hair. You've seen ladies with mustache, right? There are also ladies who happen to have hair on the chest, on the back, you know, for whatever reason. So we talk about it later on. Of course, alopecia means no hair, hair loss, okay, losing hair. So doctors, one of the things we learn in medical school is to learn complicated terms so that we can impress you. Actually, it's just like lawyers, you know, they come up with complicated terms just to impress you so they can charge you, all right? And so that it's not so easy to pick it up. Now, Dr. Loli talk about hair loss, too much hair. This sounds so cool, right? But he said, Dr. Loli talk about what? Hirsutism. Wow, what's Hirsutism? Come and attend lah. No? In order for us to learn more about hair, I think we should look at the structure of the hair. You know, we study what we call anatomy. That's another term. Anatomy means all the body parts. And what we do is we slice them up for skin. And the hair is actually growing on the skin, in case you don't know. They're not just floating up there. And the hair comes from what we call a little hair follicles. And every strand of hair you can actually divide into, basically, you cut it in cross-section. You see an outer layer called the cuticle, then the middle one called the cortex, then the inner one called the medulla. The hair is mostly black color for most people. And the color is due to different pigments, okay? the pigment, different density of different pigment. There are three types of body pigment on the hair. So whether you have red hair or black hair, depend on the proportion of it. And of course, the hair itself is basically made of the same material like your nail, keratin. Okay, so when you die, the hair don't corrode so fast. It's just like your nail. It takes a longer time compared to your flesh. But the hair itself, at the bottom of it, is living inside the follicle. Okay, and every day, hairs are growing. Okay, but then some people, for some reason, they have more hair. So, Dr. Ho, why do people have more hair, and why do people have less hair?
So it's all mainly to do with genetics, number one, and also hormones, okay? So if you look at your father, mother, your siblings, and they are a little bit lacking in hair, then you know where it's going to lead you, right? So you could try to take steps early on before
How
you
do you
lose.
take step early on?
Huh?
You say that it's related to the
Come
gene.
and see somebody like me,
Oh, I thought you.
where I can help you.
No, I thought you mean
Delay the loss.
that, take step if you are going to get married, look at your mother-in-law, father-in-law first, I mean, that's how you.
Well,
decide
some
the genes,
people
right?
want to do that, yes.
But your point is basically, if you think you got the genes where you're going to lose hair, you got to see you early, right?
Yes, try to
and not
see.
go to some of those TCM, those outlet out there that advertise themselves and charge you $4,000-5,000 for some herbal treatment. Is that what you're saying?
Well, we tend to prescribe treatments that has medical evidence supporting it. So, we don't give supplements because we want to make another $100 or something. It's all medically proven, and those are the treatments that we will prescribe you. And if you use it the way we suggest, if you come early, most likely you will do pretty well. With hair loss, one of the main things is...
let's go back to hirsutism.
Okay, so we're talking about
so
too much
people
hair.
have more hair, actually?
Yeah. Okay, so hirsutism basically refers to women having hairs in male kind of dominated areas, so like the mustache, chest, and so on. Why do they have that? Usually it's because of hormonal imbalance. They've got too much testosterone, the male hormones, going around in the body for whatever reason.
So are you saying that these ladies who got more male hair and so they're more they're actually more aggressive because they got testosterone?
Are they more aggressive? Potentially,
testosterone make men more aggressive, right?
Well, they do have more androgens or testosterone going around their body. So I haven't noticed that they're particularly aggressive. I think there's enough estrogen to balance that. But
so it's more the balance that causes
that's
them to
right.
have
It's the
more hair.
balance between your estrogen and your testosterone level. So the most common condition that we see is polycystic ovarian syndrome, where we have these young ladies who may come in with hair in these abnormal areas. They might have quite a lot of acne. We always ask them about the periods. They may have irregular periods. They may even exhibit like a very deep voice. They might be they're quite well built because they're quite muscular.
These are because of the male hormones.
That's right. So these are all clues that we'll think, okay, maybe this person has some sort of condition driving more testosterone to be in their body. We will usually run some blood tests. We might refer them to another specialist to do an ultrasound scan of their ovaries to check for cysts. And also, for a very rare percentage, they may even have tumors, like cancers, producing these testosterone.
So the question is, if you have a lot of hair, especially ladies at the wrong place, don't just think that you are very hairy, and blame it on a gene. You probably have to go and see a doctor.
That's
to
right.
scan basically your ovary and
Do
your
some
kidney
blood
area
tests, yeah.
because you could be having what we call adrenal tumor. And
That's
some
right.
of
You can have adrenal tumors or ovarian tumors
Yeah.
can give rise to these conditions.
some of this disorder,
Yeah.
basically. So therefore, go back and spread the message. Somebody with a lot of hair, don't just take for granted. Think that it's gene.
Sometimes it can be genetic,
Yeah.
but
But don't
we
take for
should.
granted,
Yeah,
lah.
exactly.
Huh.
We should screen it.
Yeah, and of course there are also people who basically take certain drugs and then they become hairy. Am I right?
Yep.
And
People who
usually
take
what kind of drug do they take?
anabolic steroids, if they are like into bodybuilding,
Or
for
they go
example.
bodybuilding.
Yeah. So they might be taking steroids, or some people might need steroids for medical conditions. And unfortunately, this might be a side effect.
Yeah, I have seen patients who got asthma, and in the past they took a lot of steroids, or they got a certain joint problem, they took a lot of steroids, and all these steroids actually caused them to change their whole appearance, right? And if you look at one of the picture out there, the lady with the strap across eye, that condition is called Cushing syndrome, right? How do they get Cushing syndrome?
So Cushing syndrome is usually seen in patients who have been given long-term steroids for months or even years, and it can be really harmful to you. I mean, I think people are aware that having too much steroids is harmful. So most people are very reticent because we use a lot of it as well. But in short doses is fine. So it's very important that you take steroids under medical supervision, under the supervision of a doctor. I know a lot of people go to Thailand to buy medicines because it's cheap, go to Malaysia to buy medicine because it's cheap, but it's not a good idea to kind of self-treat, with certain medications because it can be very dangerous.
That's so true.
Yeah.
I got patients who like to see certain doctors. They buy from Malaysia, they got knee pain. They go and take all this medicine that is contaminated with lots of steroid, dexamethasone, one of the steroid, and they end up with what we call Cushing syndrome. That looks like Cushing syndrome. Basically, the face it looks like a moon.
Moon face. You get
It
very
look
big
hairy.
centrally. You get like very stick arms and stick,
And they
stick
got a
like
lot of
legs.
hair.
And they've got quite a lot of hair. Yeah.
So these are the things, when you got a lot of hair, sometimes could be a side effect of drugs that you take. So spread the word around and tell people don't just take steroids, for no reason, for joint pain and so on. Get proper treatment, seek proper advice. So supposing somebody has too much hair, like a lady with hirsutism, there are many things we can do, right? And for me, I choose the simplest way to shave. But ladies don't like to shave. They go for waxing.
Yeah.
Does waxing work, actually?
That's why I'm sure it works. It's just that you gotta keep going, right? So
Yeah,
you've got
but-
this hormone driving your hair, and then you got to go every
But
week
it's
or
cheap,
every
right?
2
I
weeks.
mean, waxing is pretty cheap. Other than quite fun, you can just yank off, the person. Yes.
Well, it's painful, number one. I think it's fine if you have got no problems doing waxing. But it can be painful, it's time-consuming. Also, some people might have problems with these shaving and waxing where they get folliculitis, they get inflammation or infection of their hair follicles. So they start having these rashes or even irritation from the waxing or the things they use. So, for patients like that, we also have other options such as laser hair removal, which works very well.
So do you do laser hair removal?
Yes, I do laser hair removal.
So how is the advantage of laser hair removal compared to waxing, for example? You have to keep doing it,
You do it, normally what we say is you do it every month for about 6 to 8 sessions. After that, most Chinese people definitely are very happy.
So is this the same as the IPL that people go for, the zap,
Okay,
I know people even go for Brazilian wax, right?
Yes, that's right.
You know.
They go and you can do Brazilian laser hair removal. It's absolutely fine. Yeah. So it's quite different. There are many different lasers that you can use for hair removal. There's IPL as well. IPL is
But
the
which
one.
is more effective, actually?
Laser, definitely.
laser.
But even amongst the laser, there are many different types, and it depends on your skin color. For example, for Asians, you have to be a bit more careful because, the laser actually is, the laser energy is absorbed by melanin. So that's in your hair, is also in your skin. So if you go to someone who's not experienced, you might get burnt if they use too high an energy, okay? So IPL is not a laser. What it is a broad spectrum kind of device. So it has many different wavelengths. So it's
But
not
that
very
would be
specific.
safer, right?
No, it's not safer.
not safe.
I think the risk of burns with IPL is very high.
It's very high.
Yes, very
Because
high.
I know now they even have OTC IPL, so-called a little device. You pay for a few $100, you zap
Yeah.
yourself. Does this
Well,
work?
IPL, does it work? Personally, I think lasers are definitely more effective than IPL. IPL, generally, you have to go for many, many treatments, and I've had patients who come to me after 20 sessions of IPL, the hair is still there, and therefore they're going for laser treatment. So in order to keep it safe, they kind of give very low energy IPL, then it's not very effective. If you go too high energy, you might get burned. So
How about electrolysis?
they used to use like electric currents to kind of zap the hair, right? I think it's done in beauticians. People still do it, but it's probably not as popular now. I believe, yeah.
Okay. Are they like medicine that they can take if they have too much hair that, to control
Yes,
the hair?
they can have medicines to control the male hormone levels in the body. So depending on what the condition is, like polycystic ovarian syndrome, for example, sometimes it can be associated, I told you they can be quite big, right, with something called metabolic syndrome, where they may have diabetes, high blood pressure, they can be overweight. So they're usually put on metformin, actually.
So the question is, if you take these medications, to remove all this extra hair from the wrong places, wouldn't that affect your hair on the scalp as well?
Would it affect the hair on
Yeah.
your scalp? No, you're just trying to normalize the balance of your hormones, right?
I see. All right.
Mm.
So basically, some people are basically troubled by this condition called hirsutism, too much hair. So the way to resolve that is to, first of all, look out for abnormal problems in the body. For example, you could be having a tumor on your adrenal gland. The adrenal gland is an organ that sits on top of your kidney. You could be having some problem with your ovary. So see a doctor first, get ultrasound, check first. All right, before you jump to see a beautician and try to remove all this hair. You could be having some medical problem. So the advice is if you've got hirsutism, get it checked first. Then you can try shaving, olden day they use threading, or go and see a dermatologist to get a laser treatment. All right, if you have some other problem, you could also, some of these hormonal problems, they could prescribe you hormone tablets as well. This would control your problem. But there's another group of people who suffer the reverse. They don't have enough hair. Many men have this problem, and ladies too. And this problem is called alopecia. Just simply means no hair, balding. Okay? And there are different types of alopecia. This is called androgenic alopecia. Tell us about androgenic alopecia.
So this androgenic or androgenetic alopecia is the most common form of alopecia, okay? So it's due to genes, okay? So you have a family tendency to not have so much hair as you get older. And also it's driven by androgens, which is the male hormones in our body. So what makes us go bald?
Is it because they got too much male hormone, or is it the balance?
We've got testosterone. So testosterone is converted to something called dihydrotestosterone. And this is found in greater concentration in like bald areas. So that's slightly different in the different people. And you can do something about it if you get it treated fairly early. There are lotions that you can use, there are tablets that you can take, and they are pretty effective, yeah.
So the question is, the guys, when they lose their hair, they always start a certain pattern, right?
That's right.
Is there a reason for that? They usually end up with the hair only on the side, They're all the scalp. But why is it the top that lose the hair and not the scalp? Is it because the brain is there, It sort of overheat and burn up the scalp?
That's just the way we are built. For men, they have a lot of this dihydrotestosterone around the frontal hairline. So you always see men having like this M shape, right? Hair, receding frontal hairline. Then it goes to the top of the scalp where it slowly gets to go bald. And then you need to start wearing a hat, or I don't know, they comb their hair in a funny way.
No, the question is why is it that this hair, this hair is stuck down there? You don't lose them, but you lose this part.
Because
It's
you've
the
got
same
more
scalp, right?
enzymes. You see, why the testosterone is turned into the dihydrotestosterone is based on this enzyme called the 5-alpha reductase. You've got less concentration of that at the back of your scalp. So less of this testosterone is converted. And
so you're saying it's because there's a lower level of those enzymes?
The wrong thing is not there as much.
Is that the reason why when people go for hair transplant, they try to take the hair from the back?
Yeah, they
try
do.
to put it at the front.
That's right.
Does it really work?
Hair transplant does work.
But I got patients, who spend a few $1,000s to get hair transplant, and it's pretty expensive, right?
It's very
expensive. What's the
expensive.
market rate now?
Well, hair transplant is essentially something like, it's like planting rice,
Planting rice.
So you take one strand of hair from the back, you plant it where you want it to be. Now, I don't do hair transplants myself, but I know many people who do. The going rate is about $5 per strand.
Wow.
Yeah.
So you plant 1,000 strands.
It's back-breaking work, though. It can take all day. So that's why.
I got a patient who went to one of the government hospitals and got hair transplant done. And he told me how they took out the skin here, and then they pluck out all the hair, and then they poke it back on the scalp. And he came to see me, and all the hair one day, all pointing forward.
So it's not just a science. It's an
so?
art and a science. You need to go to someone who can kind of not just plant it, but also make sure they plant the right hair in the right orientation. So it's a bit of an art as well.
Yeah, absolutely. The problem is our hair down here at the back is all pointing downward. So when you pluck it out and try to put it here, you must point it in the right direction. The problem is you don't know which direction. And most of them end up pointing forward or sometimes sideways. So my patient actually ended up with a lot of antenna pointing forward, like porcupine like that. So when he comes to see me all like that. So a few months later, he came back. I said, what happened to your hair? And I saw a lot of black dot. I said, I shaved it off. I said, why? Because It's irritating lah. No, my hair is poking forward. So what's your advice? Should people go for hair transplant?
It depends on how troubled you are, right? I mean, this is our crowning glory.
Obviously, they are
Some
troubled,
people are
they're
very
troubled.
troubled by it. Some people don't mind. So if you're troubled, then, there are things you can do. You should seek help from a specialist to see, what you can do.
What can the specialist like you do for this group of people?
We prescribe topical treatments, things that you can just apply. Something called minoxidil is something that we use very commonly. So you just apply it onto the scalp twice a day, and with diligent use, after 4 to 6 months, you'll see your hair start to grow.
Use that? Can ladies use
Yes,
that?
ladies can use that very safely. Okay.
But the moment you stop that, does the hair just drop out? You know?
If you stop that, then yes, eventually it will drop out over about 12 months. It'll go back. People think that, it might become worse than before. No, it'll just become how it's supposed to be.
But is it too late when the hair is really bald to start applying? Or should you get it done earlier?
You should get it done earlier. So when you have hair thinning, don't wait until it's hair loss, okay? When you have hair thinning, go and see somebody. So, the doctor will normally ask you a few questions about maybe your lifestyle. They'll try to find out whether there's any underlying cause of this hair loss. So although we say genetics is the most common thing, there are lots of other reasons for hair loss as well.
Is there a drug that these people can take?
Yes, of course. So for the men, a lot of them take something called finasteride or Propecia.
Propecia, yeah.
Yeah. So that's a tablet that's taken just once a day and is very convenient. And they kind of
This
prefer
for men. How about lady? Can they take it?
For ladies, after menopause, there are medicines that they can take, including finasteride and also something called spironolactone. These are all things that can suppress the androgens, but because it can cause problems with male fetuses, male babies, so we tend not to give it to young women who are still of childbearing age.
So are there other side effects if a guy take it regularly?
Okay, so with finasteride, we always tell the men that 1 to 2% of these men may experience some sexual side effects.
So they end up with more hair, but they got less sex drive. That's what you're saying. They have to trade off, lah. So guys, you got to decide if you lose your hair, you want to have your sex drive, and some people think that no hair is actually more sexy. Now you want to have more hair, no more appetite. So what do you want? Got trade off. But ladies can take that. They can also apply those, right?
Yes, that's right.
Yeah.
Usually the ladies use the application first. When they get to
how long does it take for a person to take Propecia to start to see hair growing?
Propecia is quite fast. Actually, usually around 2 to 3 months they will start to see already. Yeah. The minoxidil takes longer.
But
usually
do they,
say
the
about
hair
6 months.
drop off after you stop taking?
If you stop taking, yes, it will. So you have to regard it as something like hypertension. You just have to keep taking the pill indefinitely. Yeah.
So there are drugs for people who drop their hair, and you have to basically take it early, to be effective. And you take for life, lah.
That's right.
Otherwise, if you stop taking, then you may have your hair dropping out again. What happens if those topical one where you happen to apply it, and then it drip to your scalp, your forehead?
Yes,
you end up with hair there as well.
Potentially. I mean, that's what they write on the fine print. I've never had anyone come in and tell me, Doc, I'm growing hair on my forehead or my cheek.
We have another type of hair loss called telogen effluvium. Okay, tell us more about this condition.
Yeah,
it's a form of hair loss.
That's right. Telogen effluvium is a form of hair loss, and this is basically stress-induced. But we're not just talking about daily stresses. It's like major stresses such as very serious illnesses with high fever, if you end up in hospital for operation or something, or even personal stresses like going through the bereavement of a family member, if you're going through a divorce. These can all kind of shock the system and cause your hair to go into what they call the resting mode, and then after 2 to 3 months the hair will suddenly drop off. So people do not realize that actually, because the hair doesn't fall off immediately, the hair just, instead of being in the growth phase, it gets pushed into the resting phase, and it stays in the resting phase for about 2 to 3 months before it actually falls off. So so stress, illnesses, even crash diets. Some of the young girls, they go on these crash diets, then their hair start falling off.
So young girls, if you want to go on a diet because you think you're overweight, you may end up losing your hair. So there's a trade-off again. Life is quite fair, right? Well, the word telogen effluvium sounds very technical, Basically, our hair go through 3 stages of growth. Okay, we have a first phase called the anagen phase, right? Anagen phase lasts between, 2 to 6 years? Am I right?
That's the growth phase.
Yeah, that's the phase where the hair basically actively grow. Then they go through a short period, is it a couple of weeks or a few days?
Yeah.
Called the catagen phase.
Yeah.
And then finally they go to this phase called the telogen phase, where they call resting phase, which also lasts 2-3 months. And so this is the period when if you go through stress, or you go into depression, you go through some major surgery, you have some traumatic emotional shock, then it sort of affects this whole cycle. So you end up with this kind of hair loss called telogen effluvium. Effluvium basically means outflow. Suddenly outflow of this is hair that is in the resting phase and you just drop off. Another type of hair loss is called the anagen effluvium. Anagen phase is actually the growth stage of the hair. And this stage affects certain group of people. What kind of people will suffer?
That's right. Anagen effluvium is actually not very common. It's most commonly seen in patients who undergo chemotherapy, for example. So the medicine kind of causes problems to the hair in the growth phase. And it doesn't go into this resting phase. It just falls out immediately. So instead of happening 2 to 3 months down the road, it happens a couple of weeks, after they have started the chemotherapy, and it might get worse with subsequent cycles of chemotherapy.
So these are not permanent. You actually can recover.
That's right. You can recover from them. Usually, even without any treatment, both types of effluviums will improve within about a year. Okay, sometimes we do give them a bit of help, like lotions and so on, the minoxidils and so on, yeah.
So these two types of hair loss are actually just transient. One is caused by stress, emotional outburst, crash tired. The other one is because you go through chemotherapy, it affects the growth stage of the hair. So you are perfectly healthy, suddenly lose your hair. Ask yourself, are you undergoing a lot of stress? If it is, adjust yourself and try to cope with the stress, and you'll just come back. The hair will come back. Don't need to go for a transplant. Don't walk into a salon and go and transplant. Suddenly when the hair go back, you've got a few antennas sticking out there. It's a bit weird, right? So take it easy. Don't worry too much. This is the one that looks very scary, called the alopecia areata. You may have seen that. Alopecia areata, patchy hair loss, you may have seen that. What causes alopecia areata?
This is surprisingly common, actually. It's very common. People
quite
walk
common.
in, yeah. But most patients, they don't notice it because it's asymptomatic. They don't feel anything. It's often noticed by their family members or hairdressers when they are, doing their hair. They realize, hey, how come there's like these coin-shaped hair losses on the scalp? So this is an autoimmune problem where your own body is producing antibodies that is attacking your hair by mistake. Okay?
So your body make a mistake.
Yes. It's kind of attacking itself, yeah. Okay. That's basically what it is. So it's an autoimmune condition.
Is it permanent? Is this a condition permanent?
It depends on how severe the condition is. Usually if you have just one patch, the prognosis is very good, meaning you'll recover very easily, and even after you recover, you're likely to stay well. For people with very severe alopecia areata, it can affect the whole head, or even all the hairs on the body. Those can actually do not so well. And sometimes it can be permanent, unfortunately, yeah.
So if you have this kind of condition, do you have to worry about it? Is there something else wrong with your body?
Yes.
Could you be having some other more serious condition?
That's right. So when you have one autoimmune condition, you always have to think, are there other autoimmune conditions? So things like vitiligo or thyroid problems, even other things like rheumatoid arthritis, they can be associated. So again, that's where, why you see a doctor, they will do blood tests and screen for all the relevant things to make sure that everything else is fine.
So apparently this is a very common condition. You see a patch here, you go and see go for your hairdresser, he told you, hey, there's a little patch here, there's no hair. Okay, you may have to see a doctor and get yourself screened because you could be having some other more serious conditions.
That's right.
Like SLE, joint problem, like rheumatoid arthritis. And sometimes apparently your nail also got problem.
Yeah,
right?
you get little pits in them or little holes in your nails. It runs in families as well, actually.
You look at your nail, there's like little dimple inside, small little thing, like the size of a needle. Prick, it's very small. Pitting. White dot is slightly different. This one is more pitting. All right. So if you have all these things, then you'll see a doctor and make sure you don't have other associated conditions. But what can the patient do when they have this? If they say they see a doctor and screen it, they don't have all these problems. Can you treat those?
Yes,
with the
you can
spot?
treat alopecia areata.
What can you do with
So
it?
normally we give steroid injections into the affected areas on a monthly basis, and they do recover fairly well. Usually, interestingly, with the hair that comes out is usually grey or white very often. So you kind of let them know beforehand.
So because it's just a small spot, you can give steroid
Steroid
injection.
injections.
Can you give steroid injection for those who have global hair loss?
No
like
lah,
those
no.
androgenic type?
Yeah, no.
Or can you apply steroid on your scalp?
For androgenetic alopecia,
yeah.
you can. It will
Since-
work.
Huh? Doesn't work. Why? Because
Because it's a different reason,
It's a
right?
different condition.
Yeah, it's a different condition with different
That's
underlying
because
cause.
alopecia areata is something to do autoimmune, so the steroids have to work on that. But whereas the other type is because of the male hormones problem.
That's right.
So don't just because after today's lecture, steroids work on alopecia areata, go back, buy steroid, apply on your scalp just because you have no hair. It doesn't work that way, all right? Well, we come to another set of problem that people face, dandruff. How often do you see dandruff in your practice?
Very common.
Very common.
Yeah, I
And
mean, I'm
usually
sure a lot of people. How many people here have dandruff?
How many
A lot,
people
right?
have dandruff? Oh,
Only one?
2.
Two?
3.
Really?
Okay. So
I
it
think
looks like
some
we
people
have
are not telling the truth.
Yeah, I guess so. Well,
Yeah.
we can ask them to stand up and see, whether they have or not. But what are the causes of dandruff? All right.
It's one of those things. It's like a very mild form of dermatitis due to hypersensitivity to a fungus that's normally on our skin. So for most people, they'll be fine. They just continue as normal. For some other people, they're very sensitive to this fungus, and it causes this flaking, redness, itching of the scalp. And it can be genetic. It can affect people who have oilier skins. So it's fairly common, but it's not dangerous. So that's what we always tell them. It's not harmful. Don't worry about it. And we can actually help you control it using some special medicated shampoos and also some mild steroid lotions that you
So
can
do
apply.
they actually recover after they apply
They
the shampoo?
do. They always recover, but also invariably it always comes back. Yeah, especially when you're stressed, you're under the weather, it'll come back. Also, with this condition, you always have to kind of think about whether there's any underlying immunosuppressive immune problem. So people with like organ transplant or even underlying HIV, they don't know. They have very severe dandruff. Very, very.
So you are saying that now, if I have dandruff, I have to go and see a doctor to screen for HIV and other serious problems. Is that what you're saying? So now we got a couple of people who will be very worried now.
That's a grade.
Huh?
Those with mild dandruff.
Should the guy down there who put out his hand get worried now? Maybe you got HIV. How can they tell?
Nobody can tell whether
Nobody
you have
can tell. That
HIV
sounds
until
more
you do
scary.
a blood test. Yeah, that's the thing.
So should he go for a blood test now? For HIV?
We'll have to take a lot more history.
We need to
Maybe
ask more
later on.
questions. Yeah. About their lifestyle, right?
Yes.
Yeah. But generally speaking, dandruff is quite harmless. You basically prescribe some shampoo, some topical stuff. Are there like drugs they can take?
Drugs that you can take.
Yeah,
there
Singaporeans like to take drugs. They don't
there
like to
are
apply
medicines that you can take, but it seems like you're kind of hammering this very pesky, simple condition. There are drugs that you can take. Yeah.
I see. Are there any conditions on the scalp that people may have confused it with dandruff?
Yeah,
And
lots
then,
of time. Everybody thinks
what
that it's
kind of
just dandruff.
conditions?
So other things that we see very commonly are and what we call allergic contact dermatitis, where you are allergic to something that's coming in, your scalp is coming into contact with. The most common thing is hair dye. Lots of people dye their hair. And in fact, a lot of people might have allergy to something called PPD in hair dyes that they don't know. So we, studies have shown that patients with a very mild PPD allergy, they can continue to dye their hair because they only feel a little bit of itching. It's very bearable. But you never know when it'll become a very severe allergy where you get a rash and blistering and your entire face blows up like a balloon and the rash spreads all over your body. So you never know when that's going to happen, and it's due to allergy to the hair dye. And we've seen it a number of times.
So if you have dandruff, you think you have dandruff, and and just after you dye your hair, it could be allergy. So we may have to go and get it checked as well. All right, don't just go apply all the shampoo. Interesting, a lot of people now dye their hair. What's the reason why they dye their hair?
Because they can.
Is it because
Because they look better.
their hair are turning grey, turning white?
It could be that the hair is turning white or grey.
And does actually dyeing the hair really harm the hair actually?
I think if you don't do it too often, it's fine. Of course, if you do it very often, every 2, 3, 4 weeks, it can dry up the cuticle of the hair.
So it can damage the hair.
It can potentially damage your hair if you do it very often, yes.
It seems that dyeing of hair is actually a very ancient practice. I read that in the olden days, the Italians actually, you want their hair to be red color, they actually use horse urine and pigeon poo to dye the hair red color. Amazing, right? And now, of course, thanks to science, we got all this kind of dye, but of course, it also create allergy. So maybe if you don't want to get all this allergy, try horse urine. It may help. But there are also conditions on the scalp, that are more sinister. Like,
That's right, yeah.
I don't know,
you can have, it can be a fungal infection. It's very common on the scalp, and it looks just like, it's also scaly, it's also flaky scalp. So, unless you got to get it checked. Like if it doesn't respond to what you're using.
Come and see you, get it checked. What do? You scrape off the dandruff?
Yeah, we do
fungal.
Well, it depends. You look at it. If you think it is dandruff, then you give them topicals to go away. If they have like localized areas, like small areas of scaling, then normally what we do is we take scrapings and we can actually send it off to the lab to check for the presence of fungus. And if there's any kind of infection on the scalp, we can also take other swabs to send it off for testing to check for any underlying bacterial infection as well. So that's what we do. And also psoriasis is another very common skin condition. You can get this red rashes on your scalp, on your elbows, knees. It can affect your joints. It's got a lot of other implications. So there are a lot of things that could potentially happen to the scalp. If it's something that you have been dealing with for a long time and it's not getting better, you don't know what to do, it's probably best to see somebody who can help you.
That's right. Go and see a doctor. Just because you got dandruff, you start to buy those OTC items that apply, and it got worse. It could be something else that you're dealing with. So I think it's best to get yourself checked if you're dandruff before you start applying all these things, and don't just jump to some of this OTC treatment out there that make things worse. It could be an allergy that you're dealing with. It could be a fungus. And the last thing you want to do is jump to all this unorthodox practice where they put a lot of herbs, and they make things worse. I've seen a patient, just a little bit of dandruff, they put all this herb, and then after they come back, the whole head all red and make things worse. So get it checked, because you can do skin scraping, look for fungus, Sometimes could be even a nevus sebaceous, some other things. What is this nevus sebaceous?
Nevus sebaceous is not so common, but it's potentially dangerous. So it's something that you should watch out for. It's something that appears usually on the scalp or around near the scalp when they are very young, okay? And it appears just it looks harmless. It's like a yellow, brownish plaque, like a thickened bit of skin. But it keeps growing as they get older. And if you leave it, by the time they become the person becomes 60, 70 years old, you can develop skin cancers within this nevus sebaceous. So we always advise patients to have this cut out when they are old enough to undergo surgery. So maybe after 12 years old or something. If they're okay, then we just cut the whole thing out. Then you don't have to worry about it anymore.
So there is a reason for seeing doctors who've got dandruff, to look for some of these more sinister conditions. So don't just take for granted and just, self-help. The bottom line of tonight's discussion is basically how do we have a beautiful hair, long hair? How do we stop ourselves from dropping hairs, Those that are related to genes, we can't do much, sort of checking your mother-in-law and father-in-law before you get married, right? But those that can do something about it, how can a typical Singaporean take care of their hair? How can we have healthy hair?
I think it's down to simple things like, maintaining a healthy diet, making sure that you eat all food groups. I mean, we need a lot of iron, good amounts of iron for optimal hair growth. So we need to take
iron pills for the hair?
Only if you're iron deficient. But normally, actually not just, sorry, I don't mean that. I mean, your iron levels need not just to be normal, but it needs to be high normal. So we always check the iron stores of people to make sure that they have good amounts of iron if they're already having trouble with hair loss. Eat a healthy diet, exercise, and then don't do too many treatments that are potentially harmful to your hairs. Perming, bleaching, chemicals, all that kind of stuff. I think once every 3 months is fine. Anything more frequently, you might potentially run into problems, yeah.
So basically, you have to treat your hair with a lot of gentleness. A lot of people like to wash your hair with hot water. That's quite damaging to the hair. You should actually use cool water. And then you like to blow your hair. with all this hot, air blower, and then you burn your hair as well. So when you want to blow your hair, actually the correct thing to do is actually to just blow, right, without the heat.
Blow with just medium heat or like cool, you have the cool air button. I mean, that's of course best, but it can take a longer time.
But is it good to like shampoo yourself, shampoo your hair every day?
I think you can use as needed. Some people need to shampoo every day if they tend to have oilier hair. Other people can go for 3 to 4 days without shampooing and they're fine. So it really depends on each individual. But use a gentle shampoo. Try to go for like sulfate-free shampoo. They tend to be gentler to the hair. And those are. And when your hair is wet, don't kind of comb it, very strongly, because that's when it can be quite brittle and break. So these are all little things that you can do to improve your hair condition.
I think the young ladies are concerned about this condition called split hair, right? They got split ends. So how do you solve that? And why do people got split end,
It's basically a cuticle coming away from the cortex of the hair.
How do they prevent themselves
dry.
from getting this? And what can they do about it?
Sometimes if they leave the hair too long, you get split ends, so you cut it a little bit shorter.
So you think they should
and
go
use
for
a
trimming?
gentle, you can go for trimming. You use gentle shampoos, gentle conditioners to kind of treat the hair,
So you got split end, just get it trimmed. Don't need to worry too much. All right. How about graying of hair? I get a lot of gray hair nowadays. Is it because I'm getting wiser, or is it because I got a lot of stress?
Definitely, you're getting wiser.
What can I do about my gray hair? Seriously. So I don't like to dye it because I worry about dermatitis, allergy.
I think you should just grow old, gracefully. A lot of men look really nice.
But most people don't like the idea of growing old and having hair.
Then you need to go to your salon friend.
Is there something that, as a dermatologist, people look up to you as a skin specialist that you can help me with? That's why you're here tonight. I hope you can help me.
We are working on it.
You're working on it?
Yeah, definitely.
So what she's saying is that live with it lah. Other than dying, there's really nothing I can do about it.
For the graying hair, it's often genetic, so you need to choose your parents wisely.
Yeah, so again, see, it all boils down to choosing your mother-in-law and your father-in-law. All boils down to genes, right? Anyway, if you got gray hair, basically it shows that you're wiser lah. I think so lah. Okay, but what's the reason why the hair turned gray in the first place?
It loses the melanin.
So it loses the melanin with age.
Some people with age, some people lose it faster than others, and I think it's due to genetics.
So there's nothing I can do about it, just other than choosing my mother-in-law. That's for the next generation lah.
I think with grey hair, honestly, there's not a lot at the moment, but I'm sure there's lots on the horizon.
So the bad news for you guys there, you got grey hair, there's not much you can do, just accept it, it's a sign of growing old and wiser. And those people who are losing their hair because of androgenic, alopecia, blame it on the genes. You should have chosen the mother-in-law. Other than that, I think there are medicine you can apply. The topical medications, right? Some Alopecia you can take. But of course, there are other new things out there that we may not have heard of from a scientific point of view. This could be new, cosmetic stuff we never tried before. So people ask me, should I try this cosmetic? Should I try, I'll do not sponsor a DRX. Are you going to let us try all this product? Does it work? I will say that try. You never know, but as long as it doesn't cost arms and legs and it doesn't harm you, no harm. But those out there will advertise all the time out there and then charge you $4,000, log into some scheme that you pay every month, and then after they close shop, open again, think very hard about it, because any treatment that needs regular advertisement in the newspaper, it shows something that there's no result. When there's no result, then you have to obviously go and advertise again, get new customer, because the old customer, will run away. But if you are doing a good job, like a specialist, the patient who got treated well, and they will refer patient. So that's why specialists sometimes they don't need to advertise themselves. Just a lawyer, if they're good, they don't need to advertise themselves. But if you're not doing a good job, you need to get new customer all the time. That's why you need to advertise. So my advice to our audience here is products out there, you can try, but don't pay arms and legs for it lah. And if you're in doubt, always check with a doctor first. Because sometimes you lose your hair, your certain condition could be something else hiding inside your body. That is what we are more concerned as doctors. Whether you lose your hair, gray hair, split end, these are just more your look. But it's more the sense of well-being, the health that is inside you that's more important. At the end of it, it's health that matters, right? Right? There's no point trying to look pretty, but you're not healthy inside, you're hiding something. Is there any questions you want to ask Dr. Stephanie Ho tonight?
Dr. Ho, what's one of the common myths that people have regarding hair loss? A lot of people say you can't eat this, you can't do that, and all that.
Just
the Ajinomoto, whatever stuff. What are myths and what are real?
I think you can eat practically everything. I mean, the hair is made out of protein, so make sure you've got a good level of protein and actually a balanced diet. People who don't eat red meat, we do find that vegetarians, they are often iron deficient and anemic. Then that can have a, problem. They can have a problem with hair loss, and it's very common. There are a lot of vegetarians in our community, and they don't realize that it may be related to their hair loss. And also, people always worry when they see hair on, when they're showering, shampooing, and so on. They see, wow, a lot of hair, but actually, you are allowed to have 50 to 100 strands of hair loss every day. So it's quite a good amount, okay? So a question I always ask my patients is, when you wake up, do you see hairs on your pillows? Because that means that, the hair is actively falling out, actually. So that should make you worry and go to see somebody about it, yeah.
So myths, there are common myths that Singaporeans would have, like, I get the Ajinomoto myth,
Yeah.
But I don't think
That's quite common.
Yeah, that's
what
true.
What other myths are there that,
other myths
should be debunked,
Ajinomoto.
Is Ajinomoto a problem?
I don't know. I would probably not recommend too much of it, but for other reasons. But whether it's related to hair, just take a balanced diet. Yeah.
Any other myths that are common?
Well, one of them I can think of, they say that you got white hair. Don't pull it out.
Don't pull it out.
Pluck it out because you go too strand. That is a myth.
No, that is definitely a myth.
Yeah, because the white hair comes from one follicle. Just because you pull it out doesn't mean the follicle will produce two hairs.
That's right.
All right, that's definitely a myth. So I have people who say, this white hair, don't pull it out, you end up with 10 more. That's definitely a myth. Any other questions? Yes.
I have a friend, she has scalp cancer.
Scalp cancer.
It's very rare. She's number 2 in Singapore.
Wow.
What causes scalp cancer?
Do you mean that it's a type of
She
skin
wash her hair
cancer,
every day.
maybe?
Yeah, she has cancer of the scalp.
So cancer of the scalp is part of your skin, really.
Dermatologists can't do anything because it's very rare in Singapore, and she got no chemo, nothing.
Really? Okay.
Just monitor her,
Yeah.
every 3 months take a photo.
Oh dear, I'm very sorry to hear that. Well, I think we will have to have a look at your friend to see exactly what is the problem. There are many different things that can cause cancer affecting the scalp. It could be, a basal cell carcinoma, or it could be that can be cut out and then it's cured. Or it could be something like a melanoma. If it's too large and if it's spread somewhere else, then it's something that, well, I won't say there's nothing you can do about it, but usually there are some things you can do about it, whether it's chemotherapy, radiotherapy, and so on. So yeah,
She's done her surgery and then her hair grew very nice, very thick.
Right.
She just completed her MRI.
Right.
It doesn't spread. And doctor want to give her some medicine to prevent. So she refused.
So she's cured of it. you mean?
Yeah. Then the other friend, scalp cancer in Singapore, number 1, that one spread. Hers doesn't
Yeah,
spread.
I think it's important for them to continue to be under monitoring by the doctors looking after them.
Well, any other questions? Yes, the lady there.
I'd like to ask, for white hair is cause of the loss of melanin. How to
Prevent it.
yes?
I just asked that question.
I wish I have the answer to that.
By means of food.
What? I don't think it's related to food. It's usually genetics. It causes the hair to lose the melanin. It's like why some people have vitiligo. Vitiligo is when you have white patches on the body. And it's kind of, it's an autoimmune condition. I'm not saying that this graying of the hair is an autoimmune condition, but it is one of those things that happens as we age. The melanocytes that make the melanin in the hair just are not as active as they were when you were younger. And there's not a lot you can do about it.
Well,
I'm
most
afraid,
people, by the time you cross 30 years, you find that there'll be white hair coming out,
That's right, yeah.
It's a fact of life. It's a sign of growing old and wiser. Yes.
Prevent hair loss.
Does
I
it
think,
help to like stimulate blood flow and then, you know?
Yeah, I think a lot of people, I mean, a lot of the minoxidil is based on increasing, vasodilation, so dilating the blood vessels to increase blood flow to the hair. So I think massage possibly can. Brushing, I'm not so sure. To a small extent, maybe lah. It makes you feel good anyway, right?
Yep. Yes, if not, yes.
Brain of the hair. Lately, I give my sister some virgin oil, those from Japan, but it helps a bit. Does it apply?
Virgin oil to help with what? Hair loss, ah?
No, for applying the brain of the hair. Does it help? But I found it helps a bit.
That's good. You should monitor it.
Well,
Yeah.
people will try all kind of things. As long as it doesn't cause you harm, you don't get rashes, it doesn't cause your arms and legs. So these are all subjective, sense of improvement, yeah. Yeah, most important, it doesn't cause you harm. That's the most important.
That's right.
Yeah,
I think
that's
at the moment there is no, there's nothing scientifically proven apart from minoxidil to really help with hair growth in the medical literature.
All right, ladies and gentlemen, we have come to the end of the talk show, and I want to introduce the next speaker later, but let's thank Dr. Stephanie Ho. All right, thank you, Dr. Ho. Yeah, thank you.